Good morning, everybody. First of all, I want to say thanks to Manitobans for being Manitobans, for the values that you've demonstrated so capably over the last number of weeks. We face this pandemic together, and we are truly in this together. And I say thanks to each of you for showing every day in the way you're responding to this unprecedented situation that your values are real. Extraordinary acts of generosity by ordinary Manitobans, extraordinary care and determination on the front lines of our healthcare system and elsewhere, and in so many other ways. As the Premier of our amazing province, I am not surprised by this. We've been leaders in giving to one another, to worthy causes for decades now, but we continue to stand up and do it in this time of need, and that's important. We're seeing this demonstrated once again with our Help Next Door MB initiative and the thousands of people who have offered to help others and are helping others in over 160 communities now across our beautiful province. Stepping up, helping each other. We've seen it with people listening and abiding by the health and safety rules that we have prescribed. They're necessary to protect not only each of us, but our families, our friends, our neighbors as well. And we've seen it with our frontline workers, who are truly heroes in the challenges that we face, whether in medicine, but also in education and in social services, doing their part to protect the most vulnerable among us. I've never been more proud than I am today to be the Premier of your province. On behalf of all Manitobans, I want to say thank you for all you've done, all you're doing, and all that you continue to do for your fellow citizens. You're making a real difference in our collective fight against this invisible enemy. After almost 3 weeks at least of that fight, I know that some of you are getting fatigued and you're anxious about what's next. And you should know that as your government, we will be here for you and with you all the way. Our top priority has been from the beginning to protect our most vulnerable citizens by ensuring they have the healthcare system that they need when they need it. And we must remember to protect our most vulnerable, our senior citizens, our homeless, those faced with threats of violence, those facing brand new, unanticipated financial challenges as well. We've been looking to help as many people as we can through these uncertain times and looking to do it in as many ways as we can, while remembering that we have to have a province to come back to at the end of this, and that we will lead the country in rebounding. This is what Manitobans do. They don't just think about today, they think about longer term too, and what matters. And what matters now will continue to matter as we move forward, protecting each other. Today, we'll continue to do our utmost as we announce other new aspects of our Manitoba Protection Plan that I believe reflect very well the values that Manitobans have always demonstrated. Aujourd'hui, nous continuerons de faire de notre mieux avec les annonces du plan de protection du Manitoba pour refléter les valeurs que les Manitobans ont toujours démontrées. Today I'm announcing 3 new steps, 3 categories of faster and smarter health equipment procurement, extra support and tax relief to homeowners and businesses, and increasing shelter capacity for our most vulnerable. Excuse me. These are in addition to the numerous other initiatives we have already taken, and they are by no means the end of the steps that we will take as we respond to and as we proactively deal with the challenges we're facing. First of all, faster health equipment procurement. This pandemic will place extra strain on our healthcare system. We are already seeing that. And this is why we're doing everything we can to increase resources for our frontline providers to secure the medical supplies and protections they need to care for Manitobans. I'm proud to announce today that our government is creating a special $100 million COVID procurement fund. And this fund will help businesses to tool up their operations. Some have already approached this challenge, and we thank them for that. But this will help others do the same, to tool up their operations and workforces to manufacture essential medical supplies and equipment like gowns, masks, and face shields. Aujourd'hui, je suis fier d'annoncer que notre gouvernement fournit 100 millions de dollars aux entreprises, fabricants et autres entreprises du Manitoba pour fournir des solutions innovantes dans notre lutte contre le COVID-19. We have received an outpouring of support already from business community partners who want to help in any way possible. And to make this happen quickly, we've redesigned our business portal and procurement process across government to streamline the process of connecting businesses to government as we work together to fight COVID-19. Manitoba manufacturers or businesses that are prepared to rapidly scale up production or retool manufacturing lines to develop products made in Manitoba are encouraged to visit the vendor portal at manitoba.ca/COVID-19. This portal is also accessible on www.helpnextdoormb.ca. If you're worried about hospital space, I want you to know that we are too, and as a government we are also proceeding to take actions to secure additional space if needed. Again, I say we're preparing for the worst, but we are hopeful for something less challenging than that, naturally. We're issuing a request for proposals to secure temporary space for a potential low-acuity hospital in the Brandon area, in Winnipeg and in Thompson regions. We're hoping for the best, preparing for the worst. We are also in the process of arranging hotel accommodation, additional isolation facilities and recovery centers. So this is an area that I do not want Manitobans to be concerned about. If you need the care for COVID or anything else for that matter, you'll be receiving that care. We'll continue to work with Manitobans to protect them, and we'll do this with proactive initiatives as much as possible as we fight against COVID. Nous sommes ravis de ces nouvelles initiatives qui seront à la fois proactives et réactives aux besoins d'approvisionnement du Manitoba dans notre lutte contre COVID-19. Secondly, in the category of cash flow and tax relief, hand in hand with securing healthcare supplies for Manitobans is the need to secure financial support for those needing economic relief. Today, we're expanding our Manitoba Protection Plan to provide immediate and sustained cash flow tax relief for Manitoba workers, Manitoba homeowners, Manitoba small businesses. We are providing a 4-month deferral period for individuals and businesses to pay their provincial income taxes. That period will extend to August 31st of this year with no interest or penalties. We are providing a 6-month deferral period for any interest or penalties for Manitoba Hydro or Centra gas bills, for MPI premiums, for Workers' Compensation Board premiums, and also for education property taxes. This relief covers approximately, well, we don't know exactly because we don't know the uptake yet, but potentially could be into the hundreds of millions of dollars of tax relief, most certainly. I would at this point also say, though, to those of you who are able to pay your taxes and bills on time, please continue to do so, because it is those bills that you pay that allow us to support you with health care and with the other important services of government. And so this program is designed to give relief to those who need it most, and I would encourage all of those who are able to do so to pay their bills on time. This is how we will continue to support the social programs that we depend upon in our province. We also don't want to make living more expensive for people than it already is, and we know that there is real risk out there. And therefore, we will be making home and business property insurance more affordable to Manitobans by accelerating the removal of $75 million of annual provincial sales tax from residential and business properties effective July 1st of this year. This will save over 500,000 residential property owners an average of $75, and it will save more than 40,000 small business property owners an average of $880. This is in addition to the corporate payroll tax and PST remittance deferral that we announced previously, Minister Fielding announced that a week or two ago. In addition to these actions, we're going to offer a 6-month cash flow relief to October 1st in the following areas. We will protect struggling small business owners by directing that Manitoba Liquor and Lotteries not charge interest on receivables from restaurants, bars, and specialty wine stores. We know that this industry has been particularly hard hit economically by this pandemic. We will protect vulnerable Manitobans by directing Manitoba Hydro and Centra Gas not to disconnect any customers. We are encouraging our municipal partners, and I understand that earlier today the City of Winnipeg made this decision, and we thank them for that, not to charge interest on provincial education taxes and school division fees to give greater assurance to all taxpayers. We're also encouraging municipalities throughout the province to consider doing the same in respect of their own taxes. The combination of these new measures will help to ease the stress and lessen the financial burden that many Manitobans are feeling right now, in particular as payment deadlines are looming. Thirdly, expanded shelter space capacity. While many of us have the capacity to shelter at home, some of us do not. Our government is putting measures in place through our Manitoba Protection Plan to ensure people who don't have a stable home do have a place to stay safe and healthy as we respond to COVID-19 together. I'm announcing today that we will invest $1.2 million more to add and repurpose 140 new shelter beds to support people affected by homelessness, and that will assist in allowing them to do the proper social distancing as part of the province's broader protection plan response to COVID-19. I do want to publicly thank our terrific partners for helping us do this, including the Main Street Project, Salvation Army, and the Siloam Mission, and the wonderful people who work there as well. We're grateful to you all, not just now, but year-round, as you care for those less fortunate. In conclusion, I've said repeatedly, I will say again today, Manitobans need to know that we are with them, that we are all with one another. Your government will support you and do our very best to help you through this difficult time. We're inspired by the values of Manitobans in every decision we make and every action that we pursue. But we know that the pain that you are experiencing and the stress that you're feeling is real. Whether it's because you've been laid off from work, because your income is lower, because your business is in jeopardy or your business has been closed, because you're concerned about a loved one or a family member who you cannot be in direct physical contact with right now. These are real causes of pain and real causes of concern, and we understand that. Today's announcements can't take all that pain away. We know that too. That pain is real, and we want to do what we can to help lessen it. And we will do our best to do that as we ride this out together. And I know that is what Manitobans are doing right now all over this beautiful province. So I say to you, none of us can make up for the billions of dollars that have been lost in our Canadian economy over the past few weeks through this pandemic. But all of us can continue to demonstrate the human qualities that make Canada great. Together, we can beat this thing. Happy to take your questions.
Thank you, Mr. Premier. A reminder to our journalists online, we will take a primary question and one follow-up question, and please introduce yourselves as you ask your questions. From Canadian Press, Steve.
Steve Lambert from the Canadian Press. Premier, what's the reaction been from the call-out for personal protective equipment from Manitoba companies? Healthcare workers are worried about ensuring that there is enough in supply.
Yeah, Steve, just initial indications is all I can share with you, and those are very good. Companies are inquiring and stepping up. I expect that the Health Minister, Cameron Friesen, will be able to provide you with a more detailed update early next week on the specifics around the response.
Okay, and as a follow-up, the $100 billion investment, Some of that is going to also to get medical supplies and equipment. How much have you been told that you need, and how much will this be able to cover of that?
Well, again, I think Dr. Roussin would be able to give you some idea on that, and I hope that everyone understands the challenges right now are very real of giving accurate forecasts, and the danger of giving a forecast which has a plus minus of a significant percentage is also real. So what we're doing here is clearly trying to incent additional production and manufacture of the things we need to make sure that as part of the Canadian team, well, as my grandmother used to say, you can't help the needy of the world if you're one yourself. So what we're trying to do is make sure that we're not needing this additional equipment, so we're in a better position to help as part of the Canadian team that's addressing this issue collectively. And I want to say publicly a thank you to all the other premiers and the federal government for really working hard together with one another to make sure we face this challenge as a country.
Thank you.
From CBC Manitoba, Bartley.
Bartley, the CBC. Mr. Premier, more along the lines of the equipment, why did the province wait until April 1st to issue the bid for all the products that were and services that were also in Manitoba companies were also invited to provide? I'm talking about the masks, the gowns, and supplies, and all the other services.
Sure. Well, that's a fair question, Bartley. I think you know that we were the first province to join in with the federal government's proposal for joint procurement and placed a very, very significant order for equipment weeks ago. But of course, no one anticipated, probably as accurately as we would have liked, the growing demand on the country and its resources. And so this measure is, I think, absolutely necessary to supplement those previous orders of equipment and machinery. We're not in imminent danger. The health minister will share more of that with you early next week. But we do need to prepare, and we need to prepare for this to continue, and we need to, as I've always said, remember this isn't a sprint, this is a marathon.
And as a follow-up, earlier this week, the Premier, or rather officials in Newfoundland and Labrador, issued a very desperate plea saying that they haven't been getting what they needed from the federal government quickly enough. Is there any concern on your end of that federal aid in either money or supplies not flowing quickly enough?
Always there's a concern. I wouldn't want to put it in the category of fear. We've had good support and cooperation from the federal government. This was obviously a topic of significant discussion on the national call late yesterday. I would continue to say that there are obviously challenges across the country, that's putting it mildly, that each province is at a somewhat different stage from another. We know that we have probably had a later introduction here in Manitoba, hence we're seeing lower numbers at this point, but we expect that those will rise. The fact of the matter is, this is largely in the hands of Canadians in terms of their willingness to abide by the recommendations that are continually being made and that must be enforced as we move forward. So we're preparing, as I said earlier, we're preparing for this to worsen, and of course we're hopeful of something different from that. But again, a more detailed answer to your question, I think, early next week, Bartley.
Thank you.
From City News, Stephanie.
Good morning. It's Stephanie Alexik with City News. Mr. Premier, just wondering if you can give us an update on the status of that order for PPE with the federal government.
Sorry, Stephanie. Again, I think this is where you're going to get more accurate, up-to-date information on both the federal order and also on the response to our initiatives here in Manitoba from the health minister very early next week. That's the plan. I neglected to mention something earlier, and I should say it. I want to thank the members of my caucus. I asked them earlier this week if they would forego, again, their cost of living adjustment. This past week we saw the House of Commons give all members of Parliament an increase in their pay. Every member of the government caucus voluntarily said they would not take their increase in pay. And I want to say a special thank you to them. And to say to them also, thank you for their diligent work and and for all Manitobans, the encouragement they've given to MLAs as they are facing up to this challenge too. They, like Manitobans, have the stresses in their own homes, with their own families, with their own parents and grandparents, and so it's appreciated. And thank you to Manitobans for offering words of encouragement to their representatives, because they are working very, very hard, and I know that we want to thank them for that.
This is a follow-up. The last time we spoke to you, we asked about landlords who seem to be trying to get around the April 1st rent increase freeze. And I'm just wondering if you've had more time to see reports of this since then and what your reaction is to this.
Well, I understand, and I think it is the specific case that you raised in that particular instance that the landlord changed their approach and decided to forego any rent increase. And I thank the landlord for that, because landlords have their costs too, and they're responsible for maintaining and offering a healthy place for people to rent or lease. So I say thank you to the landlords for that. The reports we're getting are that the landlords have been working cooperatively with their tenants, understanding that we need to get through this together, and understanding that the relationships that they have with those who rent or lease space from them are very important to maintain, if at all possible. And also for those who have commercial clients, who have small businesses who are leasing space, that the approach that's been taken by the partners involved has resulted in virtually all cases thus far that have been reported to us in a satisfactory arrangement for either postponing payments in whole or in part, or in offering some interest relief, if you will, and that type of measure. So this is an area of concern to all of us. We've taken steps to ensure no evictions are occurring in the interim period, and we hope to see the continued cooperation of all parties.
From 102.9 CHTM, Navi.
Good morning, Mr. Premier. I just wanted to ask about the temporary hospital in Thompson. Can you speak to how much space will be in the facility and when we can expect it to be built and ready to go?
Navi, I can't give you details because the request for proposals just went out, so we'll know better when we get the responses from that. I'm not sure, and I'm sorry, I don't know the deadline date for responses, but again, the health minister will be available, as he has been, to provide you with more detail as that process unfolds. But the purpose, of course, is to make sure that just in case we have additional needs for space and beds, that those are available to people who will be able to get the care that we want to give them and closer to their homes if at all possible. That's why we're looking at Westman, we're looking at the north to make sure everyone doesn't have to come to Winnipeg to get care. If they can be closer to home, we would prefer to see that.
And another question in regards to the homeless shelter capacity is, looking through the news release, it seems most of it is concentrated, or all of it is concentrated in Winnipeg. Is the province looking to providing shelter capacity for outside of Winnipeg as well?
At this point in time, nothing's off the table, so we'll continue to take a look at as needs arise. Right now, the needs are greatest in the city of Winnipeg, and so we're addressing the needs of those people first.
Thank you.
From CJOB, Diana.
Good morning, Mr. Premier. With regards to your announcement last week on your desire to see the federal government start an emergency credit agency to borrow on behalf of provinces at a lower rate, where do we stand on that right now? Have you discussed it with the Prime Minister, and if so, what was his response?
I'll have a lot to say on that. I'm giving this answer all the time to you today, but I'll have a lot more to say on that early next week. We pursued the idea. We think it's a great idea. We know that it will save hundreds of millions of dollars in lower interest payments, because we know that the federal government can borrow money for less than half, for example, the cost that we would have to pay in Manitoba to borrow it. I want to be really clear. We're not asking for a handout program here. We're quite willing in Manitoba to assume our responsibilities, and we will. But when the federal government can borrow on a 30-year bond at 1.3%, which is the current rate as of yesterday, and it costs us more than double that, then it's really important to have that lower interest rate be the one that we pay. And so we're asking the federal government to do the borrowing, in a consolidated and organized manner for provinces who are going to face growing liquidity challenges. As revenues drop, we still need the money to maintain our social services. It isn't coming from taxes because people aren't able to earn the money they're used to and would like to earn right now. And so we're simply asking that the federal government do the borrowing at the lower rate for us and transfer those savings back to the provinces. And fundamentally, this is an issue of whether you want stronger banks or stronger health care. And I would like the federal government to understand that we're ready to work with them to make sure this happens. It isn't a high-cost initiative to any taxpayer. It, in fact, saves hundreds of millions of dollars from Manitoba alone. And over the next decade, that could be into the billions, big billions, for provincial governments who are the first responsibility for managing health care. So if we can save billions of dollars and have that money available to support our health care system, I just think that's a great Manitoba idea. And I'm proud to tell you today that every premier agrees.
And then just as a follow-up, as far as looking at hotels being used during the pandemic, what can you tell Manitobans you might be preparing for? I know we've heard they could be used for healthcare workers who need to isolate, but what is the range of services you could see happening sort of in a just-in-case scenario?
Yeah, that's a great question. I say it's a great question because I just asked it about an hour ago myself, so I give you credit for that. But it is quite possible that we're going to need to free up intensive care beds in our other medical facilities, and so that I'll say the lower needs patients may need another place to stay while that happens. And so we're looking at that. We're also looking at isolation requirements, not just for frontline healthcare workers, of course, but for anyone that they may need to social distance. And some folks may not be able to get back to their home because they don't want to spread the virus to family members. So we are getting advice, as always, from Dr. Roussin and our health experts on how we may be best able to accommodate these additional needs. And we're getting great support and cooperation from the Manitoba Hotel Association, and I thank them for that. I'm sorry that their hotels are not as full as they'd like to be right now, but I do have mixed feelings because if we need rooms, they are available. And so we're working with the Hotel Association and its members to make sure that if that capacity is needed, that we're prepared for it.
From Global, Brittany.
Good morning, Mr. Premier. Brittany Greenslade from Global News here. You spoke again in this press conference by saying that Manitobans need to abide by the directives laid out by Dr. Brent Roussin, or they must be enforced. We're hearing from many people daily who've tried to call in or email the province about people that aren't abiding by these gathering regulations and are being told they don't have the ability to be enforced. Why aren't we enforcing them, and when are we going to start?
Well, Brittany, I can only tell you that we've been acting on the complaints we've received and will continue to do that. And as you know already, I have very little patience for those who are so thoughtless and stupid as to ignore the well-being of themselves and others. The reality of this is it's a monumental challenge we're facing right now, and it doesn't need to be added to by dumb. So I'll encourage Manitobans, all Manitobans, to continue to do the right things. There are fundamentals that will help you win in sport and in life. And some of those fundamentals involve, but are not limited to, thinking about other people besides yourself for a minute. So let's make sure we abide by those fundamentals. Also, if we can make sure that we're encouraging others in the appropriate behaviors, that's helpful too. And so I'm asking all Manitobans to not only abide by these things, but to, when you see they're not being abided by, help us. Because there's only so many people that can work for the government and solve this problem for you. We're going to have to work together. We're going to have to help each other. And we'll beat this thing, but we're not going to be helped by people who aren't on the team. So I'm asking Manitobans to join with us and help. We are following up as best we can, but we also must run frontline health care and protect people who are ill and people who are getting ill. And we must deal with the stress levels that people are facing right now, and we are offering as best we can to support our most vulnerable people. But if healthy Manitobans will abide by these rules and respect one another, we will be helped in that. And if you can help us with that, we would appreciate that too.
And my follow-up, Premier Ford today saying he's going to release their worst-case scenarios that he's been briefed on. Have you been briefed on Manitoba's possible worst-case scenarios, and will you be making that public? Why or why not?
Well, there's a tremendous desire for people to know the end of this story, right? The challenge is none of us do. And so making accurate predictions on something that is totally unprecedented is an incredibly difficult thing. There are disadvantages in putting out numbers which may, frankly, be totally inaccurate. I understand that right now, your first question was, why are these people behaving badly in the face of what should obviously be a chance to be a caring and reasonable citizen, right? So, look, I'm not interested in trying to scare the hell out of everybody in the province just so that some people start to pay attention. Every province has been talking about this. We talked about it on the call last night. There are pros and cons to putting out big numbers. You saw the United States do this week, talking about hundreds of thousands of deaths, potentially millions. With everything we've done as a government, we've tried to be accurate. With this one, I hope people accept and understand this is without precedent, and so putting out numbers 2 or 3 weeks into a situation like this without any precedents to go on or to base our stats on is very, very difficult. That being said, it is our intention to put out some projections next week, as other provinces are planning to do as well, to give Canadians something of a sense of where we're going. But I would hope all Manitobans would understand this is guesswork, and the real work is being done on the front lines of our healthcare system right now, and it's being done in the homes of people in Manitoba who are washing their hands, covering their mouth when they cough, observing the social distancing guidelines, and making sure they're the front line of preventing the problem in the first place. If we continue to abide by those fundamentals, then we have a chance to really flatten that curve and sooner. If we won't, then we don't.
Thank you.
From the Brandon Sun, Drew.
Thank you. This is Drew May from the Brandon Sun. Mr. Premier, I know you've spoken before about the revenue challenges that the pandemic will have on the provincial budget, but can you comment briefly on what the measures announced today will mean for the province's finances?
Yeah, I can tell you when I have the uptake on the programs we've offered interest forgiveness, we've offered penalty forgiveness, we are going to lower take the PST off your home insurance, off commercial or small business property insurance as well. That one we have an estimate of a little less than $100 million. On the others, depends on the uptake. Potentially, if everybody didn't pay their taxes, we could be talking $3 billion. But I've urged Manitobans who can to pay their taxes because if you don't pay your taxes, I guess we're just going to have to borrow more money, and then your kids are going to pay for it someday, plus interest. So that's not a good solution. We need everybody who can afford to pay their taxes and their fees to pay them, and we need to help those who can't afford to right now. And if they can't afford to, and you're willing to help them, then pay yours. That's the solution.
Okay. And just to follow up on the previous question around the on the shelter beds, do you right now have an idea of when places outside Winnipeg might be seeing some homeless shelter bed capacity?
As I said earlier, our first concern is the frontline needs of COVID victims, and the consequences of having more COVID victims in our existing facilities are that we may need additional beds outside. Brandon and Westman are, of course, always, they're always in our thoughts. And in the case of Brandon, we're already proceeding with a request for proposal to make sure we have additional capacity, but this is for health situations. Now, that isn't exclusive to people who are homeless, for example, and so when you ask about shelters, remember that hospital beds must be made available for all citizens, regardless of whether they have a home or place to live on a regular basis or not. So we're looking to expand the capacity to take care of all our citizens on their frontline health needs, first and foremost, right now.
Thank you.
You bet.
From the Winnipeg Free Press, Carol.
Hi, Premier. It's Carol Sanders at the Free Press. My question is, it's been reported that some provinces are helping out provinces that have been harder hit by the pandemic. And has Manitoba loaned any of its personal protective equipment to other provinces?
When we have a situation, Carol, where we can be confident that we're satisfying the needs of Manitobans, we'll most certainly, as we've always done, offer help to others. As I said earlier, and I'm reminded of Jesse Pallister right now, you can't help the needy of the world if you're one yourself. Right now, we don't have the confidence of knowing that we've satisfied the needs for every aspect of equipment and protective gear in Manitoba, and so we're hardly in a position to help others, and that's too bad. We'd all like to be. That being said, as this thing moves along, other provinces are further along the curve than we are, and I've spoken to other premiers about this. And we will, if the worst case scenario evolves in Manitoba, maybe weeks later than in other provinces, they've already committed that if they don't need the gear they have, and they've prepared as best they can as we have, that those transfers will occur. We're all part of the Canadian family, and we're doing our best to make sure that we're not dependent on others, but we, at this point, are not totally confident that we may not need additional gear over and above what we have in some capacities in the weeks to come. There's, as I said earlier, no emergency right now, and the health minister will share an update with you early next week, Carol, but that would be the intention. I'd love to tell you we're not going to have any more cases. All of us would like that, but that's not real. So let's be real. The numbers are going to continue to rise. That's the nature of this type of pandemic. It always has been. The question is, how fast will those numbers rise? And that's the part that only Manitobans really are in charge of right now.
Okay, and for my follow-up question, what would you say to the families of people right now with loved ones in the Bedell home in Gimli and others around the city who are starting to get pretty alarmed about infections and COVID-19 cases coming up positive among workers in those facilities and people waiting to find out if their loved ones who've been tested are positive?
Yeah, well, you know, Carol, you know where my wife's family are, and you know my concerns, our family's concerns are very real and they're very deeply felt. But we feel that way about all our seniors across the province as well. And so I would say to the people at Bedell, remember that you have great caring people there that are doing their absolute best, that we believe, and Dr. Roustan will have more to say on this later, I believe, that we have caught this early. And so I don't want them to worry unnecessarily. I understand that they have been able to test everyone, and I understand that the officials there are doing their very best, as they always do, because it's a beautiful facility. But of course, there's a reason they don't let me go into seniors' homes during campaigns, Carol. It's because I don't like to leave them. So I'm very concerned for all our seniors, and obviously we all are. But at this point in time, I can only say I know the officials there are doing their absolute best. And I believe Dr. Roustan will have more to comment on later today.
From the Winnipeg Sun, Josh.
Good morning, Premier. This is Josh Aldridge with Winnipeg Sun. Just looking at your earlier statement today at the beginning of this press conference, you said Manitobans are concerned about hospital capacity, and so are you. You also said a lot of these moves are kind of preemptive moves to make sure we have that capacity. But how concerned is the province about hospital capacity? Are we getting pretty close to the point where these needs are immediate, or do we have some wiggle room here? How concerned are you about that hospital capacity?
Well, I'll let Cameron Friesen answer that, Josh. I'll only say this. We're always concerned about it, but we're not immediately concerned about it. And I think that's about the best I can do at this point. Obviously, we're seeing a spike in the number of cases, but that was not something that wasn't predicted. That's something that's happened in every single province, and it's sadly, it's continuing. But I have noticed, as you may have, some slowing in some of the provinces already. And I've noticed that, of course, as you have in other nations. So as people grab on and take seriously to the challenges of facing up to this, we tend to see progress being made. But that must continue. And so again, I say to Manitobans, thank you for doing the right things. And if you see someone who isn't, thank you for talking to them about it, because no number of government police is going to change people's habits. It's us helping each other change those habits that's going to be the major difference maker, I think, right now.
My follow-up is, unions have been complaining that their staff who contract symptoms of COVID and have had to self-isolate in regards to healthcare workers. They have to rely on banked 6 days. When those run out, they stop getting paid. Winnipeg or Manitoba is one of the few provinces doing this. Is the province going to come to the table and pay healthcare workers during their self-isolation as no fault of their own, that they're off work, and really they're doing good things by being off work if they're sick or experiencing those symptoms?
Well, there are, all of us, I think, feel a sense of gratitude to our frontline healthcare workers right now that we should probably feel on a daily basis anyway. That being said, as far as paying people who are taking time off beyond their vacation day time, that's very, very generous, I would say, compared to most people who are not in the public service. That's not in the offing right now. We're doing everything we can to find daycare spaces for frontline workers. We're focused on finding protective gear and making sure that that's available to frontline workers. We treasure and value the work of frontline workers. This isn't the time for unions to try to advocate for additional non-existing benefits. So let's just work together and understand all of us have challenges we have to face. There are a lot of people in this province facing those challenges, and I know that frontline workers, and I respect the fact that frontline workers are facing them too. And I understand that union bosses have to advocate for the things they want, but I'm not convinced that this is the time to do that particular thing.
Thank you.
From CTV Winnipeg, Jeremy.
Good morning, Premier. Jeremy Sherrill from CTV Winnipeg. A bit of a follow-up to the question about projections. I'm looking right now at the numbers from Ontario. They've just announced anywhere from 3,000 to 15,000 deaths is what they're projecting. I know you're saying it's a bit of a guessing game, but I'm wondering, given that Manitoba is still so kind of early in this, comparatively to other provinces, our numbers are very low. Couldn't this perhaps be an important tool to help those people that aren't following social distancing guidelines realize the impact this could have?
Yeah, it's a fair question, Jeremy. If we want to use a scary projection and think it'll scare some people who are, so thoughtless as to not abide by the protections that would protect them and help them protect others, then I guess we could use it that way. But when you see the Ontario projections and you realize that that's about a 500% disparity between their low number and their high number, you have to ask yourself, how helpful is that really? So we're pulling together our best guesses. We're going to share those with Manitobans, but they are guesses. And I would emphasize again that the real work begins at the home and in the workplace, following the fundamentals of making sure you stay healthy and helping others stay healthy as well. The real work isn't in projections.
And the follow-up question is in regards to borders. Many provinces have decided to close borders to non-essential travel, interprovincial borders. I know you've said that this isn't something that's going to do yet, but people traveling to cottage country, is that still an issue, and is it something that you will consider doing if people continue to travel across the border?
It's not off the table. It's something that we're going to have to have among the several dozen things we have to consider as we move forward here. That being said, we'll face that challenge when we feel it's appropriate. Right now, we're doing the informational distribution. The advisories are being given out at the Saskatchewan-Ontario borders. That is actually a more significant blockage than exists between many Canadian provinces right now. So yeah, there's a range of approaches that have been taken by each provincial government in respect to this, and I expect you may see that continue. But we'll continue to take the necessary steps to ensure the health and well-being of Manitobans as best we can.
Thank you, Premier.
From Radio Canada, Patrick.
Bonjour, M. Pallister. Patrick Foucault from Radio Canada. Minister Stephenson asked yesterday that all daycare reopened to help frontline workers and eventually critical workers. And we have health workers telling us that they're so confused with the process to fund a daycare, how they can do it, and where they can find the information. And we also have daycares saying they only have one kid or a few kids basically registered. So can you clear up that confusion for parents and tell us what they have to do to find a daycare?
Yeah, they can go on the COVID website, they can register, they can get help from our team. Hundreds already have. We're, I think, very close now to 1,000 frontline workers that have got childcare because of the matching service we're offering. I encourage frontline workers to use that. We dealt with over 2,500 calls 3 days ago, 2,100 yesterday. I expect today maybe a slightly smaller number. So we're continuing to look to position all frontline healthcare workers' children in the hands of caring childcare workers in our province. And I encourage the 2/3 of daycare centres that have not yet reopened their doors to these children to do so as soon as possible.
Thank you. And as for my follow-up, so we're almost at the half of that 30-day state of emergency. Will you, when will you consider maybe extending it?
Sometime before the end of the 30 days. Merci. Just want to say thank you to everyone again. Please continue to do the right things to protect yourself, to protect others. Make sure that you demonstrate, as you have been doing in every possible way, your thoughtfulness for others. Be kind, be patient, be supportive. Don't hoard supplies and try to resell them for more. Don't play football. Right now, just care for yourself and listen to the directives and make the necessary decisions that will help save lives. Not every generation has a chance to do that. Right now, because of this pandemic, you do. So do the best things, do the right things, and in these difficult times, show what your true character is. It's easy to pretend you're a person of value when things are going well, but when the challenges present themselves, that's when your true character starts to emerge. For those in this province who understand Manitoba and its history, we understand what our real values are. And I'd ask all Manitobans to put those values on display now as we face this challenge together. We will beat this thing together.